Hi and welcome to this very brief introductory video to the MEAH. So I'm just going to share a screen with you now that will look at an introduction of what MEAH is, and it will show you where to get some further examples to look at it. The purpose of this is part of the training for physiotherapists in order to get them engaged with psychological skills training, the MEAH really being part of that. So that's where we are with it. So let me just share screen. So hopefully we've got here, lovely. Go full screen. You can see that great. So the training today is on the MEAH, and that's the model of emotions, adaptation, and hope. So the content really is to look at what's the purpose of the training, consider the MEAH scale itself, what it is, what it represents, how it's looked at, consider some principles for interactions. How do you communicate in a positive way for someone who's experiencing a difficulty? And finally, consider some additional questions you might want to ask. So the model, the MEAH is a model. It's designed to aid interactions, and it's accompanied by some additional questions. So we've got sort of principles of interaction. We've got the MEAH to guide the interaction, and some additional questions that we can ask. Okay. And we've got some example videos that you can look on afterwards. So we want to keep this short. I know that's the feedback I've got, keep it short. And then hopefully, if the opportunity arises at university, have a practice of using it, which again, we found really useful with the students. So the purpose really is to prepare you to use MEAH, or think about having MEAH as a resource. And that could be a resource that you hold in your head, or a resource that you have as a bit of paper that helps you guide a conversation. And it's based on the idea that there's often a primary difficulty that people might express towards a particular situation. In this case, we're looking at chronic illnesses and in particular neurological illnesses, but it could be applied generally. And I've delivered it for students over COVID with students. So it's very versatile. We want to get you prepared to deliver a therapeutic interaction over a short period of time. And we want you to have experience and understanding of why interactions are needed when people are facing difficulties. We'll also think about some of the challenges and how it can go wrong and maybe why. So just come back to this question. Why is it, what is hard about listening to a difficulty someone else is sharing? Often when we think about those moments when somebody shared something and it's really hard to hear. Maybe it makes you feel quite anxious. Maybe you're thinking, I don't know what to say. That actually really, the MEAH really hopefully is designed to deal with that situation where as a therapist, we're thinking about how do we respond here? What do we ask? How do we go about this? So really, it's an aid for that. When we say, well, what is the MEAH? It's originally a screening tool for people to fill out in a very short way. So the whole point of it is it's very brief. We've got 5 questions. We've got a principal question that identifies a difficulty. So if I was asking you watching the video, what is the one thing that you're facing right now? Maybe you're struggling with, maybe you're finding that's a real challenge. Is there something that stands out? For someone with a chronic illness, let's say a stroke. So since a stroke, is there anything in particular, or maybe right now that you found difficult to adapt to? Something which is, if you had a list of things, that this may be the one thing that you think actually that's a real challenge. So once you've identified that, it's a case of using 4 questions to look at how we map that difficulty. How do we understand that difficulty? And these questions can also give you an idea of the therapeutic questions that can help people, and they look at hope, adaptation, energy, and feelings. So let's break that down. So one thing the MEAH does here is we're reconceptualizing adaptation. Adaptation can often be thought of as categories. They're not devalued by this, but categories like denial, being realistic, false hope, they have a value, but they also have a danger. And the danger is if when they're used to stereotype reactions that we're hearing. So as a therapist, we hear information, maybe on difficulties and challenges, and how we respond to that is we might say, well, that sounds like I can't accept this. So typically it might be that we understand psychological adaptation within such categories. The MEAH is sort of breaking that down a bit further to say, actually, let's think about hope, let's think about adaptation, let's think about mood, essentially. Okay, so it's saying also there's no right or wrong adaptation. It's what it is, and often what's expressed to you might be quite normal given the circumstances the individual that's sharing you has gone through. Okay, so we're moving away from categories, and one thing we like to do is look at stories, and we found that MEAH links to stories. Okay, so if we start focusing on what's going on with the experience, with the story that the individual's telling us, and what's underneath that. Okay, categories, like I say, may limit potential, and they may limit how we understand and interpret what's being shared. The MEAH captures a relative difficulty. It gets someone to name it, and it converts it into a score so we can document change. So it can be used in that way, or it can be used as a simple aid to a conversation. So it can be used in slightly different ways. Okay. It's made up of 2 outcome measures. So we've got the hope and adaptation scale that I developed in 2016. And then within the same article, you'll see that actually that scale was something that could be combined with a very well-used scale, which is called the circumflex model of effect. And so the hope and adaptation scales, the first 2 questions, the circumflex model of effects is the second 2, and between it, we get a good picture of how someone's adapting to a particular situation. So when we look at the MEAH map, what we've got is hope, no hope, to acknowledgement and certain hope. We've got from rejection or inability to accept to positive embracement, where in the middle, again, we've got acknowledgement. Okay. We've also got on the map the 2 MEAH questions. So the white are the hope and adaptation questions, the yellow here, and then the other white, you can think of it as a different plane, is the MEAH questions. And do we have high or low energy? And how do we feel about this, positive or negative? And when you combine that, you get a picture of the mood. Right, let's just break down the scale a bit further. There's important points on the scale. For hope, possibility, and uncertainty are very similar constructs, but can have quite devastating outcomes if something's seen as uncertain. Uncertainty is something which is introduced because of illness and needs to be considered how we manage it in conversations. So the middle of the scale is quite important, where we're acknowledging in the present what's happening, and able to look forward to possibilities. So if we take out possibilities, if we directly challenge what someone's saying to us, and therefore what's possible in their eyes, there's a danger. The danger is how do they respond to that. So part of the conversation training is about listening really and understanding, looking through the individual's eyes in order to help them and empower them to maybe consider ways forward and ways of looking at things. When we look at the last 2 questions around mood, we can, from those 2 questions around high energy and low energy, and feelings around unpleasant to pleasant, positive, negative, when we map those scores, we get moods, emotions. So that's why it's useful. So we can understand how someone's feeling about anything by their responses to a scale. when we think about the first question of the MEAH, so have a think about what you might say you find difficult. And I think with that, I think what I want you to understand is, in order to understand the difficulty that you'd identify, you almost need to understand what's happened to you in a bit greater detail, to contextualize it. This is my difficulty, this is why. What might someone with a stroke say? What might someone with another neurological difficulty say? What would their difficulty be? Would it always be the same? My answer is it probably wouldn't be the same, because there's lots of variables that mean how we respond to difficulty and challenge changes massively. I think of our most recent work about, we looked at a story around people's story with strokes for how they overcome things and what challenges they face, and they're various. So we can have people going through a very similar physiological problem, but how they respond to it and what the difficulty is for them is very different, which is what we need to understand a little bit more. And also thinking in why is hope important here? Often, if we're hit by an event out of the blue, we're not prepared for it. We're having to start to readjust, to start to think about what implications that has and what it means. When we think about hope and why it's important, the things that people might identify as their challenge or difficulty can relate to hope. What they name can relate to hope. And one of the things that we look at, if you look at any of my literature, is generalized hope, so all levels of hope. So the most important challenge or difficulty to overcome is to reduce suffering, and that could be pain of some kind. So often people want to stop that first. If that's something that comes up, that's natural. We've got other hopes that might be identified as a challenge. So when a chronic illness comes in, I think we can have changes in identity, relationships, and activities, work included as part of that. So what's named will often link to these different aspects, and that's what someone might need to have a talk about if they haven't been able to talk about it so far. So one of the ideas is we get to what's hard to talk about, but that's okay, because often we found across multiple studies now that, that there's a lot of value in being able to share and be able to feel like you're heard. So one of the purposes of the MEAH is to help you listen in order to generate trust, and that trust then will aid, without doubt, your rehab that you do with any one individual. So we thought about the first question, what's the difficulty? The second question that relates to the MEAH, how hopeful are you that you can change this? Do you feel like you've adapted to this difficulty? How much energy do you have at the moment to deal with it? And how do you feel about it from positive to negative? Those questions could be asked like that, as simple as that, to aid in interaction. They could be given a prompt like, okay, so when you know the MEAH scale, you can say, so how hopeful are you that you could change the difficulty from no hope to sort of like, I'm not sure, I could, it's possible, to completely certain. Again, the same for adaptation. No, it's not something I can adapt to right now, or yes, it is, I can fully embrace it. Actually, I'm using it for the benefit of myself. To in the middle, acknowledgement. So you can see how we can have a range to prompt and get information from the individual, or we could use it as a scale. So at this point, I'm just going to stop sharing on this and start sharing on the different versions of the MEAH. So this was a slightly older version, and this version we've used successfully online. So what we got here is a numerical response. Why it works online is for particular reasons. Some of the reasons are around online communication, and that's fine. So you'll see that actually when we ask the question around what's your difficulty to name, and then we score it by a scale from +4 to -4 on each question. What I was talking about then is how can you use it differently, and remember we could ask questions, or if we wanted a prompt, again we could, this is available to you, You could have a shorter version of it to help you in an in-person interaction. So it can be used for screening. It can document scores, or it can just help aid a conversation, or it could just be used once you know it more as questions you have to explore something that's revealed to you. Let's come back to the PowerPoint. So we've got a set of 5 questions. We can use it in different ways. It can aid the therapeutic interaction. And then we can have other questions. So if you just slightly reverse the recording, you'll see there's a few other questions that can aid and support you explore a difficulty with an individual. I think there's some principles behind the therapeutic encounter we want to really encourage. I think it's very easy to want to give advice. If someone shares you a difficulty to face and you can see a solution, it's very easy to want to give that solution. But for the purpose of when we're thinking about difficulties, challenges, trauma from someone, we just need to listen to start with. We need to understand. So when you're looking at interaction, please consider the questions as a way forward rather than direct advice. So we're not going to fix anyone's experience of trauma or difficulty or challenge. We want to empower the individual. So we also want to see who else they talk to. There's different interactions that occur between peers than there is from a patient to a healthcare professional, because there's a relatedness, there's understanding, that there's shared knowledge that can be really, really valuable. So it may be a starting point of seeing it on the internet. How can they explore different reactions, experiences, different considerations? And that's a really nice way forward. So we're trying to empower the individual to look and understand if there's a difficulty in the interaction, how others deal with that difficulty. Because more often than not, the others will have developed coping strategies and be able to give really good advice that's often accepted and embraced or used. In another way of putting it, other stories can be taken and used to help change the individual stories. So a more positive outcome can be achieved. When we think of it in practice, I want to refer you to the my YouTube channel here, and one example of conversation is here. So if you just click on this link, I won't play the video. I'll just stop share, start share. Hopefully this will come up. And then let's just as well, hopefully you can see this. This is the channel. What we've got here is a little bit more information for you, but examples. So an online example, an in-person example. That'll be really useful for completing this training. Okay, let's just finish off with this. I think there's a few more principles of interactions I want to consider before the training ends here today. Remember, the individual that's speaking to you, if they're sharing a difficulty that's really hard to listen to, that they've got here today, and they've coped this far. So remember that people have potential to change and grow and make choices themselves. Remember, there's no need to fix the problem. So obviously as therapists, and some people may want that and they'll directly ask for that. But if it's not asked for, I'd say ask questions, try and empower. Don't worry about creating change. The person that comes into interaction with you goes away changed, because often trauma, difficulties and challenge can take years to change, years of therapy. So not being able to create change is not a problem. The idea is that you don't create further problems and we avoid directly challenging what difficulty is or how it should be viewed based on what you think might be better. Some principles again help. I think it's really easy to remember the LED, listen, be non-judgmental with the stories you hear, be non-directive, with the person that trying to explore, ask questions about what you hear. Maybe consider metaphors. Metaphors are communication devices that are used to reveal that there's something there. Let's think of, I'm in a storm right now. It feels like I'm in a fight. When people share metaphors, it's really worth exploring them because there's something behind it, and there might be certain social rules which are there, which stop them sharing more deeply, stop them being vulnerable. So consider metaphors as a way to explore further as well. Or you said this, trying to pick up, and this is a skill that comes with time, pick up on what's been said just to explore a bit more. Oh, you said this, I heard you mention that. Can you just tell me a little bit more about that? And then direct, we use stories to create change. Okay, so we're not going to give any directional advice, but rather we use questions to direct, we use stories to direct. We listen, we'll explore, and direct. Okay, so I'll leave you with looking at some examples. That's the end of the training. And what we've also got in place is opportunities to talk to people with various neurological conditions as part of the courses. So consider the options there and the opportunities there for you to practice different ways. Thank you for watching.